was trying to be more active, and I started cycling, and I went off the side of the trail and straight into my ring finger. And that's pretty much where the brunt of my entire body went, and that broke that finger really well. I may or may not have cracked it back into place. And because I was only a mile from the hospital, I ended up just riding my bike right into the ER. And I told them that I was done cycling and that I was ready to check in.
We have 3 little bones in our fingers, and he broke this one right here called the proximal phalanx. And when he saw me back in August, is when he originally broke it, it was displaced, meaning the bone was in the right spot, and it was angulated. So he underwent a surgery to get this bone into a better position. And we put pins here in the back of the hand to get it in the right spot. And anytime we break any of the small bones in our fingers, we always worry about stiffness, both before surgery and after surgery. And after surgery, just with the nature of the injury and the surgery itself, he got really stiff afterwards. So we sent him to our hand therapist here, who has done a remarkable job of getting him back on track. And I always tell patients it's one thing to put the bones back together, and that's the easy part for us, but it's actually the dedication and the hard work of both the patient and the therapist to get him back to his normal routine. And he's done an excellent job. And Jay, go ahead and show us what you can do there. And he's come a long way from when he originally broke this and kind of gone through the early post-operative time frame. So it's very important therapy after any sort of hand surgery.
Just like anything else, all of the tools that we have in our tool belt here, not every technique works for every patient. So the technique that we utilized and have been utilizing for the past couple of years is something that's called casting motion to mobilize stiffness. But it's very significant in the fact that some of our stiffest of patients are patients that are not succeeding. We can implement this and get results that previously we were not able to obtain. So that can help prevent patients from maxing out insurance benefits. It can help prevent them from having additional surgeries like tenolysis or capsulotomy, and also gets them back to using their hand, which is ultimately what we all want. The process is that when someone gets injured or has a hand that they have not been able to use because of pain, because there are pins through a joint, and we have to allow that hand to not move for a while until you're allowed to start motion, is that you learn adaptive patterns. So you start using the hand differently. And some of what you get with the casting technique is that we redirect the motion to the joints that are the stiffest or the structures that aren't moving. So you take away all the things that the patient can do, and then you make the joints that you're trying to improve the motion in, that's where the force is directed or the motion is directed. But we have a lot of patients who are utilizing it who have had tendon repairs, fractures, just overall stiff hands from a crush injury. I mean, there's no specific diagnosis that it works for. You're not treating the diagnosis, you're treating what you see. Thankfully, we work in an environment where the physicians that refer patients to us we're a team. So we communicate with them, we talk to them about different ideas and things that we can do to help their patients, and they will collaborate with us because there are different things that they may have repaired that they want to give a little more time to heal before we start the casting technique. But this technique has been a game changer with some of our toughest of patients. Most patients really like it because they can move so much better. As odd as it sounds, putting a cast on them, they feel like they're making some progress where they hadn't been prior. So that's encouraging for them to see that they're like, oh my gosh, I can move my hand now. And they couldn't move it maybe for months or weeks prior. Just being able to go back to work and use their hands and life, all of that stuff is really important.
Basically, I started playing Lego like as a kid, like the 90s, and I got out of control. I started buying all sorts of Lego sets, and then eventually I started building my own creations. In downtown Troy, there's a Mayflower, the new theater building that they're renovating. I built a replica of that. It has the circle with the Christmas tree. There are 3 other buildings that are right next to that and across the street from the Mayflower. So I built those buildings, and that was one of my recent projects that I actually worked on right after my accident. And it was one of those things when you're sorting and digging through parts and everything that it kind of helped me with that little range of motion on my hand, forcing myself to actually kind of work it.
Oh, as a hand surgeon, we owe a debt of gratitude to our hand therapists because they're an invaluable part of the team here at Orthopedic Associates. And Jay's done a remarkable job as well, because it's also one thing to put the bones back together, but if he's not doing the exercises and getting moving, then the results just won't be what they need to be. So we do have dedicated hand therapists at several of our office locations, which makes it very convenient because we can send patients directly over to our therapist that day, and we have excellent communication with our therapist. If they have an issue with one of our patients, they can walk right just a few doors over. And having that relationship with the therapist, and like I said, is so important with any aspect of hand surgery, and it's something we're very proud of. Good job, Jay.